Childbirth is a natural event, although a recent tendency is to intervene and turn it into a surgery. According to the World Health Organization's data, cesarean births should happen in 15% of the cases. This percentage, which is respected at a global level, is met only by 14 states. Caesarean section is underused in low-income countries and peaks in middle and high-income countries. Italy is one of the countries with the highest rates. In 2012, more than 38% of births occurred by caesarean section, with a significant change from region to region. But let's take a step back. Caesarean section is a surgical procedure performed whenever abnormal conditions complicate vaginal delivery, threatening the life or health of the mother or the baby. The birth choice is made upon information provided by many actors. First, the Ministry of Health. It regulates the practice of caesarean section and defines the guidelines to improve health care. Second, non-governmental organizations. They launch awareness campaigns to inform about the risks of unnecessary caesarean sections. Third, mothers. They rely on other mothers' experiences, besides institutional information. Lastly, the healthcare system. Notwithstanding an informative function, it passively satisfies the patient's will. Taking Italy as reference, these influences do not explain the unequal distribution of caesarean births among public and private hospitals, which should rather be investigated in the type of communication the structures make. From a semantic analysis conducted on hospital websites, it emerges how public and private hospitals deal with the topic of delivery and present themselves to potential patients. The analysis highlights that private hospitals provide more information than public ones. Additionally, to inform on the topic, public and private structures use different and sometimes antithetical words. On the other hand, the image private hospitals introduce themselves with affects the caesarean section rate. Rather than the traditional hospital setting, the names of the clinics evoke a warm and familiar place. The imagery associated with them is also fostered by terms related to structural and aesthetic qualities of the hospital, satisfied needs of patients and feelings associated with hospitalization, quality of medical and nursing care, and any other non-hospital services. So if it's true that in Italy more and more caesarean sections are performed in hospitals that can best satisfy women's desires, adopt effective communication, list benefits first, and provide insurance against possible complications, perhaps the definition of caesarean birth should be rephrased. Caesarean delivery nowadays is not only a life-saving procedure, it is a conditioned choice.